See a countdown soon.
Oh,
All right, looks like we're getting ready. All right. We are live, rocking and rolling and rolling and rocking. Happy Wednesday, y'all. How you feeling?
feeling good, man. Feeling great. Blessed.
All right.
Excellent.
All
Please
right.
excuse the floral shirt. I'm coming from sunny Jamaica, broadcasting live.
Oh, you're live from JA? Okay.
Live from
Okay.
JA.
Okay.
My
Oh, you
daughter's
do.
winter break.
We're not gonna get on this gear, but yeah, you living. I see you.
You're doing this. You're doing this a little dirty, man. We're up here in the cold of New York. All right, it's like, what was it, like 8 degrees today, Dr. Hinson?
Yeah, something like it.
Yeah.
I won't tell you how nice it is here, but please know that I'm soaking up some sun rays for you both. All right.
Okay. Just so I can feel good. What's the temperature like today in Jamaica?
Oh, it's a balmy, perfect 80 degrees.
Oh, that's crazy. Yeah,
I'm gonna just live vicariously through you. Exactly, you are flexing.
I'm on my way back tomorrow, so it's like right back into reality.
Okay. It's a temporary flex. All right, we'll take it. We'll take it.
Yes.
For those of you joining us, I know it's about 7:02 right now. We are live here on Instagram. Shout out to I see Madam Black Mink. What Madam Black M Inc. I know who you are, Kua. How are you? Good to see you joining. And Reels and Rhythms, of course. Keep joining, sharing. We are live here on Instagram with Dr. Maurice Hinson and Dr. Matthew Jones. My name is Chris Williams. Of course, you know why we're here. We're talking about heart health. February is Heart Health Month, and many of you know that I started this journey and this platform focused on Black men's health out of my own personal journey with heart health as a multiple heart attack survivor. So this is something that's very important to me, and I know it's very important to many of you out there, especially to my brothers. All right. So for the sisters that are on, please share and get some of the brothers to join and spread the word. But right now, today, the topic and what we're here talking about is the importance of prioritizing heart health. The show is called Keeping the Beat, Real Talk for Black Men on Heart Health and Wellness. And who better to have this conversation than Dr. Matthew Jones, an interventional cardiologist, and Dr. Maurice Hinson, a primary care physician. Both brothers are here in New York. They work around the city, but Dr. Jones is based in Brooklyn, and Dr. Hinson he gets around. He can be in Queens, he can be in Brooklyn, he can be wherever you need to be. So I'll let the brothers introduce themselves. Starting with Dr. Hinson, please, my brother, introduce yourself.
Yeah, of course. Well, first, very much appreciate the invitation. I get asked to do a lot of different talks and platforms and podcasts, but it's always nice to come back home and speak to us. So I appreciate the opportunity. Once again, my name is Dr. Maurice Hinson. I'm a general internist. Currently working at Jamaica Hospital as a hospitalist. So for people who are admitted to the hospital, I take care of them. I'm also a primary care physician through MediRootz Medical Group, which is a telehealth-based primary care practice where we specialize in the delivery of high-value care. And in doing so, we integrate both the advancements of Western medicine and the evidence-based practices of traditional medicine, like herbal medicine, sound healing, chiropractic, acupuncture, and so on and so forth. Of recent, I've gotten heavy into the cannabis and psychedelic space, especially as it pertains to mental health disorders like mood disorders, depression, anxiety, PTSD, substance use disorder like opiate abuse, and just overall neurologic, neurocognitive, and neurodegenerative disorders. And so, through my academic pursuits, through research, through lobbying, and now, as a provider, I'm able to enter into that space and bring those type of modalities in conjunction with what we do in conventional medicine. So very much looking forward to the conversation.
Wow, that's powerful. I mean, Dr. Matthew Jones, please introduce yourself to the audience and let them know more about you and what you do.
Definitely. Thank you. It's an honor and pleasure to be here. Chris, such an amazing platform that you've built. Really looking forward to the exciting things that are, in the pipeline for you. Dr. Matthew Jones, I am an interventional cardiologist, so to speak, the plumber of the heart. First generation American, second generation in cardiology. My father's a cardiologist, retired, practiced for 40 years. I'm HBCU trained and an interventionalist as a plumber of the heart. Basically focuses on minimally invasive techniques to unclog arteries in the setting of heart attacks, poor circulation of legs, and so forth. So I've had the pleasure of being in the space for over 8 years. And, my private practice is located downtown Brooklyn, 2 blocks from Barclays. And my other hat as a medtech entrepreneur, I was instrumental, the founder of a smart ring technology with ECG and PPG technology to unearth and uncode the electrical signatures of the heart, what's called the electrocardiogram. Along with my co-founder, who is an electrician of the heart, an electrophysiologist, Dr. George Stewart Mendenhall. We spearheaded key IP, which has been cited by Apple and Google alike for the seminal work that brought up Apple Watch Series 4 and above with ECG technology. So I've been happy to be a pioneer in this space with the device coming soon, with hopefully, God willing, the first FDA clearance in a smart ring for ECG technology. So I'm a staunch advocate of prevention. Despite the fact that I like to unclog arteries, I think that the best situation for everyone is that I don't have to put in a stent with the appropriate preventative care measures. So I'm in a bit of a evolution when it comes to my practice and, focusing on holistic approaches for heart disease prevention.
Listen, I'm just glad to be here with both of you because I got to tell you, for those of you that are joining, I have the privilege and the honor of knowing both these doctors. Dr. Matthew Jones is my cardiologist. Dr. Maurice Hinson is my primary care physician. Both of these gentlemen have done amazing work on me and are still working on me to help me to be a better version of myself. So I'm bringing this here to share with you all, men and women alike, but I specifically want to get my Black men to plug in and really pay attention to this because it's needed. It's important for us to have this conversation. Like heart disease, and Dr. Jones, you can attest to this, is still a leading cause of death among Black men, right? We are, and most heart disease, I would have to say 90% of heart disease is preventable, is treatable, and reversible, correct?
Absolutely. When we look at the landscape of heart disease, I like to use simple analogies so that it sticks with people. So when you think of the heart, think of the 3 parts of it: the pipes, the pump, and the wiring. The pipes and arteries, which can become clogged, which represent a different type of heart disease called coronary artery disease, which can lead to heart attacks and so forth. Then you have the pump, the 4 chambers that circulate blood to your various organs in the body. And weakening of the pump, stiffening of the pump can lead to a form of heart disease called congestive heart failure. And lastly, the elaborate network of nerves, the wires, so to speak, embedded in the heart muscle that generate and propagate the signals that tell our hearts how fast and when to beat. They too can go haywire, so to speak, and basically lead to a form of heart disease called arrhythmias. Now, alluding to what you said earlier, the number 1 killer, coronary artery disease, is still at the top, where the presence of coronary artery disease can influence other parts of the heart, so to speak, weakening the pump, causing arrhythmias, electrical problems, and so forth. And when you look at the landscape in terms of the numbers, prior to COVID, we were on a downslope in terms of the rates of death still at the top in terms of comparatively to other disease states such as cancer. But after COVID, we saw a significant uptick in the rates of heart disease, and also especially in the rates of heart attacks in people younger than the age of 40. There was some belief that the virus is tied into the increased rates, definitely by way of increasing inflammation and so forth. But when you take a step back even further and look at the heart disease epidemic in Black and brown individuals, although the rates are slightly lower, our outcomes are far worse in terms of increased rates of death, lack of appropriate medical therapy, preventative therapy to thwart this deadly disease.
And this is a question for both Dr. Jones and Dr. Hinson. I want to know. I mean, you both have been in the space of health and wellness for everyone, really. But as you think about Black men, why do you think we have higher rates of heart disease and hypertension compared to other groups?
I can start with that. For one, is a matter of ignorance. I think that the difference between illness and wellness is a matter of information, right? So one thing, we're not informed. We don't actively engage with the healthcare system, and that, to me, that's also very much nuanced. Given the historical atrocities committed against Black people, Black men in particular, is no surprise that there's a high level of distrust in the healthcare system, and rightfully so. I don't object to that, but at some point we have to still engage with the healthcare system in order to prevent the onset of disease, rather than waiting until the disease is so severe that the only thing that they have left for us are its emergent services, its surgeries, and end stage maintenance therapies like dialysis. If we enter into the field, into the system earlier, and are able to prevent these things, and we don't have to treat them. All right, and the outcomes are significantly better. So for me, is a matter of information and a lack of actually going to the doctor for whatever the reason is. And I think at some point we have to learn to hold ourselves accountable for the things that happen to us. We have to make better lifestyle choices. We live a life of unhealthy habits, and so after a while, it plays into our health, and then we end up, being on a number of different medications, or having to see different specialists, having to have different procedures performed on us. And again, all of these things could be prevented, but we have to see our doctor earlier on.
Makes sense. Dr. Jones?
Yeah, no, to piggyback off Dr. Hinson's, excellent, breakdown. I look at it as a problem that precedes the womb and is after the womb, right? When we're in our mother's wombs and during conception and development, and all the ills that we're exposed to from entering this world, right? And so from that perspective, and as a physician, we are detectives, right? We want to unearth the reasons why people have disease, pathophysiology, right? And so from the perspective of before the womb, we have growing paradigm of what's called weathering, where the generational of systemic racism has been shown and proven to have detrimental impact on our growth and development. And we can see this in our DNA repair mechanisms, first described in survivors of the Holocaust, but now gaining a lot of attention and research from the perspective of the African diaspora and the African American and Black experience, Black and brown experience. So with that, I mean, we start to see evidence of this in terms of low birth weight, which is tied to heart disease later on in life, which unfortunately, it's difficult to say how much we can do to impact that. However, after the womb, we have the social determinants of health that also influence the manifestation of hypertension, high blood pressure in our communities. Over 60% of Black and brown people over the age of 18 have hypertension. It's appalling. right? And when you look at what are the societal aspects of that that contribute to it, Dr. Hinson mentioned the distrust of the medical community. So seeing and recognizing issues too late, far down the line, the detrimental impact of food, of lack of access to healthy food, intake of heavily processed foods that are high in sodium. When you look at the exercise or lack of access to quality exercise, even though some of us are of the street calisthenic rage, but all too often, many times we are weight and obese, which can have a direct impact on your resting blood pressure. And then lastly, our stress coping skills, or what's called our neurobehavioral interventions, prayer, meditation, getting in touch with one's spiritual side to offset the detrimental effects of having a revved up autonomic nervous system where you're in a fight or flight state, this adrenergic surge all the time.
I want to touch on that a little bit because we talk about, you mentioned fight or flight, and Dr. Hinson, you've spoken about this. Dr. Jones, we and I have spoken about this. When we are under a tremendous amount of stress, right? So for my brothers who work jobs that are extremely stressful, whether you are working for any one of the city jobs, whether it's FDNYs, NYPD, MTA, whatever, or just brothers across the country who are in stressful, high stress environments, oftentimes you hear about this fight or flight. Like, what sort of impact is that having on our health in terms of stress if we're not doing what's necessary to relieve it?
I mean, chronic stress kills. The persistent elevation of cortisol, the effects that it has on our insulin sensitivity, which affects our blood sugar, which affects our weight, which then affects our blood pressure, and the fact that we know that situational hypertension is a real thing, what's known as white coat hypertension. And anecdotally, I see this all the time in my clinic, where you have a person of color that is eating right, of a healthy weight, doing all the things that they're supposed to, but yet and still they have elevated rates of blood pressure, elevated blood pressure measurements at the office. And then when you take a home blood pressure log, a lot of times you see normalization of their blood pressure. And time again, reflexively, they come into an environment, i.e. the doctor's office, and their blood pressure it gets sky high. Just because of that, the fear, the anxiety, right? And I tell them that, what you feel is no different from the stress you feel from the microaggressions that you face day to day, from the, arguments and tiffs that you have at work and so forth. And that's why it underscores the importance of neurobehavioral interventions that go beyond the pharmaceutical interventions that I effectively can't treat. Yes, I can give them things to blunt the adrenergic surge, but is that really the appropriate thing when all it needs a resetting of your mind state?
Yeah, exactly. Just to add on to that. So, when you consider all of the issues, surrounding what goes into determining our health, Dr. Jones mentioned the biopsychosocial elements of our health. Stress is one of the most undertreated and underappreciated pathologies that we're constantly dealing with, right? Everyone talks about the diet, everyone talks about exercise, and they're extremely important. But stress mitigation is equally important, if not more so, because it's one of the most difficult to treat and manage, especially given the failure of our healthcare system in addressing mental health disorders. I mean, I don't know anyone from an underrepresented background who doesn't have some form of PTSD, who doesn't have some form of anxiety, depression, and just as Dr. Jones said, there's a direct correlation between stress and health outcome, in the sense that the cortisol levels that are released when you're stressed tell your liver to produce more sugar. When that happens too often, for too long, too high, becomes diabetes. That same hormone, cortisol, goes to your blood vessels, tells them to get smaller. That shoots up your blood pressure. When that happens for too long, that's called hypertension. Cortisol, after a while, causes fat to deposit in your body. So now we're talking about high cholesterol, obesity. And then when you're exposed to cortisol for too long, it suppresses your immune system. All right. So now you're more at risk for infection. Right. And again, because we failed to properly address mental health disorders, now we're walking around with all these issues and no real way to offload it. Right. So then we always say, okay, well, go seek therapy. Well, not everybody does well with therapy. All right. Therapy takes a long time to work if it works at all. Not everyone can afford therapy, and there aren't enough therapists available to appropriately address and adequately address the needs of our society. And so this is one of the reasons why I got into the cannabis and psychedelic space, because I do think that these modalities will revolutionize how we address and how we approach mental health disorders, especially the psychedelics, because it really helps us to unpack the trauma that we may have repressed in a healthy manner for the most part. But again, you can't give these things to every patient. Every patient is not an appropriate patient to use these things. And so we have to get creative in how we use these different modalities. But I am excited that they're now becoming more readily available, because the more that we have access to these various modalities, the more we'll be able to fine tune certain regimens for patients. This is what we mean by individualized medicine, right? Being able to address the biopsychosocial of the individual rather than treating the disease. Let's get back to treating the person. And so, when it comes to stress is one of the main focal points that I address, because there are ways to mitigate stress levels without the need for paying for a therapist or any other sort of expensive treatment. Breathing. We don't really give enough credit to the importance of breathing, diaphragmatic breathing. That directly suppresses that sympathetic drive, that stress-related drive, so that now you're increasing your parasympathetic system, you're decreasing your heart rate, you're decreasing your blood pressure, and you're decreasing your cortisol levels. And it costs you nothing to breathe. You do it all day, every day, and nobody's charging you. Sound healing, certain sound frequencies like 432 hertz, 528 hertz. There have been studies showing that these frequencies in particular help to reduce cortisol levels. They reduce heart rate, they reduce blood pressure, they increase oxytocin, which is the love hormone. So you get a sense of compassion, of love, of relaxation. All right. Oxytocin is released when mothers give birth to a baby. It's released when you orgasm. So it's that connecting hormone. And so there are different ways that we can incorporate low costing or free stress relieving modalities. This is the matter of us actually embracing them and doing them.
So not to make light, but that last comment I want to circle back to. Are you saying then that sex can be good for the heart?
Yeah. But you have to be careful. You have to be so in the acute act with your heart rate going. If this is why so many, you hear men who have massive heart attacks during the act, because of the adrenaline and the sympathetic drive. But over time, the chronic effect of sex is actually helpful. They actually just came out with a study that showed that people who have intercourse more frequently actually live longer. So,
and I would probably say, and I'm circling back to this, and I'm talking about this, and the reason I'm bringing this up is because I want everyone to be able to connect and relate to this. Having a loving relationship, right? And I've heard this. I've heard things like kissing for a certain amount of time, hugging for a certain amount of time, having a loving relationship. These things can be beneficial to our longevity and to our health. Would you say that these are things that can contribute to, one, relieving stress, and two, sort of helping to improve our life?
Absolutely.
Overall? Yeah.
Absolutely. I think, Dr. Jones mentioned it briefly. He talked about the spiritual element to our existence. To me, that's the biggest deficit that we have. We're spiritual beings before anything, but our current healthcare system doesn't even entertain the idea of the spiritual self. It completely negates it because we can't see it, we can't touch it, we can't measure it, we can't reproduce it. And so they act as if it doesn't exist, but it's actually the most important aspect of our existence. And so to disregard the spiritual self, I like to say, is like building a house with no regard for the foundation, right? That house is bound to crumble. And that's where we see our healthcare system now. It's just failed, it's crumbling. But when you engage in these relationships, love, that's love is the ultimate connector of all things. When I talk about spirituality, I'm not talking about religion. I'm not talking about, Casper friendly ghosts. I'm talking about the understanding of the interconnectedness of all things, the interconnectedness of mind, body, spirit, the interconnectedness that we share with each other, with our earth, with our universe. So that love, that bond that you share with another person, yeah, that helps to improve the state of your health. It actually helps to reduce the sympathetic drive. I just mentioned the release of cortisol. When you have that orgasm, when you have that sense of companionship, that love, you increase your oxytocin levels. Oxytocin is a direct inhibitor of cortisol, so it does the exact opposite. All right, so I mean, by far, these relationships matter.
Yeah, Dr. Jones. Yeah, go ahead.
Well, let me just finish.
No, I'm loving this.
Yeah, let me just
go
finish.
ahead.
That relationship could be the best thing for you or the worst thing for you. So you got to be mindful of who you keep around you.
Right. Facts.
Facts indeed. I love the concept of the relationships and the universe, and connectedness to the universe. And I want people to take a little tour on the inner universe, right? Do you know that there are more non-human cells in your body than there are human, right? And what I'm referencing is the elaborate array of bacteria, good, some bad, collectively, the genetic material, what we know for them, it's called the microbiome. And the emerging research behind how these microorganisms influence the presence of chronic disease, our emotional state, it's amazing, right? And so just to piggyback everything that Dr. Hinson said, I mean, these relationships are key, right? And so just like how you have external relationships with your family, your friends, and that is important for a better mental state, which then imparts a better state of health, and prevention of heart disease. That same relationship applies with those internal bacteria that live within us. And I want to go even deeper when you start looking at the organelles, the mitochondria that we form a symbiotic relationship with millions upon millions of years ago, that are the precursors to the bacteria, and how emerging research is also showing that the health of our mitochondria is really at the root of all forms of disease. These powerhouses of the cell, once we're taught in biology high school class, influence so much from diabetes to heart disease, and ultimately leading to dysfunction when there's high levels of inflammation, which then affect increased rates of what's called reactive oxidative species. These are things that go around and scavenge and steal electrons and promote an electrical imbalance, which that balance is needed for normal day-to-day functions. And when you think of it from the perspective of like, okay, well, it's a powerhouse of the cell and it's a battery, and you have a specialized cell and then specialized tissue and then an organ, you can see how loss of that tiny little battery on the cellular level can then impart a widespread cascade effect of disease. And from the perspective of heart disease, we know that the greatest predictor of one of the greatest predictors of one's mortality is their VO2 max, right? Their cellular respiration, how efficient they are in terms of the utilization of oxygen from their heart and lungs, mobilizing it to areas, skeletal muscle, and so forth. And so, I just want to focus on that relationship, because just like how they're external relationships, they're internal relationships that you need to be aware of and foster good health. So eating probiotics, making sure that there is a healthier balance of the more positive, bacteria that support decreased rates of inflammation. And likewise, exercise, those things that we think of as preventative measures all tie back to how it affects our mitochondria. So just think about that. The world
Interesting.
within.
Interesting. So here I am, right? I am getting ready to be wow. And when I think about it, next month I'll be 52 years old, right? I had my first heart attack at the age of 42. Going to the doctor every year for my physicals, doing everything I'm supposed to do, getting EKGs, but none of that was like clearly telling or showing any signs for me to know that I would have had this heart attack. What is it? What sort of tests should we be doing? And at what age should Black men start getting their hearts checked? And what are some of the ways? Because we know EKG is one, but that doesn't always tell the story. What are some of the things that we should be doing, Black men should be doing, and at what age to stay on top of, or at least be aware of, their heart health?
So, going back to the analogy of the pipes, pump, and the wiring, there's specialized tools to use to evaluate each part, right? And by far, as I mentioned, given the fact that the rates of heart disease are highest in the pipes, coronary artery disease, I love what's called non-invasive imaging using coronary calcium scores, and the higher form, a coronary CT angiogram. So these are basically CAT scans of your heart, one with dye, one without dye, that tell you before there's even a problem that you have buildup in your pipes. So calcium score represents older, hard, matured plaque. And whereas the dye that is given during a CCTA or coronary CT angiogram can give you the insight on softer, immature, younger plaques, so earlier on in the life cycle. And it's important to know both, because if you have a high calcium score, that means you have a higher risk of a future heart attack. And if you have premature onset of soft, immature plaque, well, that's an opportunity for us to really aggressively hit home the preventative lifestyle, which many times is a hybrid approach of lifestyle and pharmaceutical medications, appropriate pharmaceutical medications, because some can be questionable, but the combination of the two, I feel, are the best approach to remedy the situation.
Okay, Dr. Hinson.
Yeah, so I think what you're getting at, even when you do what's considered the standard diagnostics, you can still miss a lot, right? And that's a failure on our part as a healthcare system, because we tend to only look at things that we can group, that we can diagnose, right? And it's usually at the point where we're having symptoms, right? This is a symptom-driven healthcare system, unfortunately. Rarely do we address the root cause of the problem. When I think of heart disease, there's several things that I think about which drive the development of heart disease, and especially when we talk about coronary artery disease, or what we call atherosclerosis, right? So atherosclerosis is a disorder of chronic inflammation. And you'll hear me say this over and over and over again. Chronic inflammation seems to be the root of virtually all chronic diseases, whether we're talking about obesity, coronary artery disease, hypertension, diabetes, high cholesterol, depression, anxiety, dementia, cancer. These are all disorders of chronic inflammation, right? So what I'm doing now with patients that come to see me, no matter what age, we're looking at several markers of inflammation, right? We're looking at high sensitivity CRP. We're looking at ESR. We're looking at CRP. Just to get a baseline to see where they are.
Could you just tell me what those are? CRP, and what does that stand for?
These are inflammatory markers: erythrocyte, sedimentation rate, C-reactive protein, and high sensitivity C-reactive protein.
Okay.
Right? These are just basic markers of inflammation. All right. Another thing which drives, and we're learning more and more, that's driving the development of coronary artery disease and the metabolic syndrome entirely. So hypertension, diabetes, high cholesterol, obesity, is insulin resistance. Okay. Insulin resistance seems to be at the core of all these disease states for the most part, the majority of it. Right. And when you break down the reason for insulin resistance, you find out there's two reasons for insulin resistance. One, insulin itself, which sounds counterintuitive, but makes perfect physiologic sense, because anytime that the body is exposed to something over and over, it develops a tolerance to it, and it reduces the effect of it. And in order to get the same effect, you have to produce more. So over time, you have to produce more insulin. This is what we see in type 2 diabetes, right? We keep saying diabetes is about sugar. Well, no, diabetes is not a disease of too much sugar. It's a disease of too much insulin resistance, okay? And it's the insulin that's driving the insulin resistance and the inflammation. And so what I'm doing now is we're getting baseline fasting insulin levels. Because if I start to see your insulin level, your fasting insulin level increasing, now I know you're headed to the wrong direction. Now I know you're headed towards becoming diabetic. And we see a direct correlation between fasting insulin and A1C, which everyone or most people are familiar with, that test that you get every 3 months to determine whether you're diabetic or not. And once it hits 6.5, then they say that you're diabetic. Well, the increasing in fasting insulin actually happens before you start to see an increase in your A1C. So I'm all about addressing the underlying problem and addressing it as early as possible. So I'm looking at fasting insulin levels in conjunction with these inflammatory markers. And then the last part is we keep talking about the stress axis, right? The sympathetic system. You'll hear this. So you have two parts to your autonomic nervous system. You have the sympathetic nervous system, which is your fight or flight. And that's where you get the release of cortisol. That's where you get the elevated heart rate, elevated blood pressure. And then you have the parasympathetic system, which is called your rest or digest. All right, that's where you see a decrease in heart rate, decrease in blood pressure, and your more anti-inflammatory pathway. Well, there's a parameter that we call HRV, okay, heart rate variability, which seems to correlate with autonomic function. So what I'm doing now is I'm testing HRV in patients who come in. If they have an HRV that's more consistent with sympathetic overdrive, then we know that they're at higher risk for developing things like coronary artery disease and heart attack, strokes, and so on and so forth. And so for me, it's those three areas that I'm looking at and to establish a baseline of who's at greatest risk for developing heart disease.
You know, if I could just jump in there, I'll be remiss to say that, you know, anecdotally and beyond that, what's known is that it's very difficult to pinpoint individuals that are at increased risk for heart disease. We know the traditional risk factors: high blood pressure, diabetes, high cholesterol, but by far what I appreciate, family history is very significant. So you can have individuals that do all the right things and by all intents and purposes are considered low risk, but you know, suffer premature death from heart attacks and so forth. And so when you look at the landscape of where cardiology is going in terms of personalized and digging deeper into this concept of inflammation, we know that as someone ages, they have an expansion of mutant white blood cells. And white blood cells are basically the key to inflammation. On one side, when they are acting appropriately, you know, against foreign offenders, they save our lives. But when revved up or when mutated, they are the key contributors to vascular damage leading to atherosclerosis, as Dr. Hinson mentioned, in combination with the presence of high cholesterol. So think of the white blood cells as the brick layer to the bricks of that form the plaque as being the cholesterol, right? And so we know when we look at one's genetic predisposition, there's this emerging concept of what's called clonal hematopoiesis of indeterminate potential. Translation: as you get older and with chronic stress and oxidative stress, as I mentioned, and going back to the world within in the mitochondria, damaging your bone marrow, which bone marrow what produce white blood cells. As you get older, you see an increased risk or increased release of these mutant white blood cells that go on and lead to these inflammatory cascades that do all the badness that ultimately lead to plaque. And we also know that there's a genetic predisposition for certain types of cholesterol carriers. what we call lipoproteins, in which some people have elevated amounts of lipoprotein A, which is a carrier of LDL, which literally carries the plaque in conjunction with inflammation, white blood cells, into the walls of our arteries, leading to plaque progression. So you have to stop for a second and say, wait a minute. When I do a CAT scan of the heart on a 70-year-old hypertensive diabetic hypertension, and their arteries are clean, and I see a 40-year-old with 30, 40, 50% blockages, what we would term clinically silent, meaning not causing any chest pain, we have to stop and think, okay, something is missing here that we're not getting. And what we are understanding is that predisposition where you have the earlier release, in some cases, of these mutated white blood cells, CHIP for short, and also this genetic predisposition for aggressive metabolic disease in the form of Lp(a) and high cholesterol and so forth. This milieu then creates this environment for heart disease. So, I mean, I would love that it would be as simple as understanding just the markers of inflammation, but we know that inflammatory responses come and go. So I can have a normal period of no inflammation, my CRP levels are fine, and then I can do something where they spike. And it's hard to pick up that, right, in between serial blood testing. What I'm hoping that we'll have in the near future is genetic assays that can identify these mutations on the side of the white blood cells, these CHIP mutations, where we can see that, okay, these are people that are higher risk for these inflammatory responses that we know are tied to plaque progression, build up in the arteries. And when you pair that with these inherited markers like LP, we know that, boom, you're at very high risk. You should get a CAT scan of your heart, starting at maybe age 40, right? And get on an intensive lifestyle medication regimen, but of course emphasizing lifestyle to thwart the unfortunate genetic reason that you have.
So you just said something, and we touched on a few different age groups there. Like I said, I had my first heart attack at 42. What age would you recommend? And Dr. Hinson, you're a primary care physician, so you're sort of the first line of defense. What age should men start to assess where they are with their heart health? Are we talking from your 20s? Are we saying you got to wait till you're in your 30s? Like, where are we going with this in terms of understanding our heart health and being preventative, taking a preventative approach?
I think everyone should at minimum, everyone should have an annual. Even if you're completely healthy, you're an athlete, all these things, you should have at least an annual. If you have other risk factors, say you have a family history of heart disease, you have a family history of cancer, that's more reason to come in and see your primary care doctor sooner. Unfortunately, Black people of African descent tend to have more severe disease and tend to have a higher mortality from these diseases because we're not catching them earlier, for one. And in some instances, we just have more severe disease for whatever the case may be. And so I would say, from the time that you're in your early 20s to start having an annual. All right. And then if you have a family history of these things, then that's the reason to have a conversation with your doc. Be like, okay, when's an appropriate age, to start screening? For example, colorectal cancer, right? From a national guideline standpoint, they've reduced the age of colorectal cancer screening because of the increasing incidence of colon cancer over time. And that's directly correlated with the toxicity of our foods, without question. But for Black people of African descent, I think the age should be even sooner. All right. If you have a family history of colon cancer, or if I see that you have other risk factors like obesity, you smoke, high blood pressure, diabetes, then we're going to talk about, okay, maybe it's not 45. Maybe we should start doing a fit test, a Cologuard at 40, maybe not a colonoscopy, but we need to start doing these other non-invasive screening tests. And with respect to the heart, again, it's a matter of risk factors, family history, your biopsychosocial history. So if someone to me is at risk, and those other modalities that I mentioned with the inflammation, the heart rate variability, and insulin resistance, if I see that you have either of those are positive, then we're going to talk about more aggressive screening tools earlier on. And so it would be impossible for me to give an exact age, because again, everyone's situation is different. It's a matter of having that conversation with your primary care doc, given the risk factors that you present with.
Yeah. So one of the things I will say is this, right? If you are obese, if you are if you know you're diabetic, if you have high blood pressure, these are signs of, or indications that you should be going to get more extensive testing to understand where you are from a heart standpoint. Correct, Dr. Jones?
Absolutely. I mean, they're risk factors for a reason, in the sense that, as Dr. Hinson mentioned, it reflects systemic inflammation, systemic disarray, right? So from the onset, if you have any of those risk factors, high blood pressure, diabetes, high cholesterol, obesity, or family history, that should ring the alarm that, number one, I should be seeing my primary care doctor on an annual basis. And then from the perspective of a cardiologist, because, a lot of people ask, well, when and who should see a cardiologist? I feel that any of those risk factors being present, warrants at least, one visit, and I think that where the field is going, akin to where we are in colorectal cancer screening, I do believe that calcium scores and the higher form CCTAs, CAT scans of the heart, will be used in a very similar way, where you'll have an upfront screening for inappropriate individuals, with high enough factors, so that you can see before the plaque has become an 80% blockage, right? You want to see it, if it's there, when it's clinically silent and not causing any restriction of oxygen delivery to the muscle of the heart, right? You want to see it when it's what we call non-obstructive. Now, the scary thing is non-obstructive disease can lead to heart attacks in and of themselves, like a 20% blockage causing a spontaneous rupture and so forth. But nonetheless, you want to understand if it's present on an anatomical basis. So before, we do stress testing, there's a high, false normal rate, right? Whereas when you look at these newer modalities, the predictive value is much higher, because it's not looking at indirect measures of whether or not plaque is present. It's looking directly down the barrel of your vessels, down the chamber, and understanding if there's early signs of plaque. And so I feel like that is the first form of personalized medicine. And then adding, as Dr. Hinson said, all of the inflammatory markers, adding all the advanced lipid testing, cholesterol testing, as I mentioned before we get to the realization of the widespread use of genetic assays, not just for the rare birds of heart disease, but just for the commonalities of heart disease that we see, and how and who is at risk and who should be treated. So that's the future, but there's a lot of things we can do now.
Yeah. This conversation there's so much more that I think we could touch on. And this is why I know we're going to have to continue this conversation as an in-person sort of discussion. So we're going to follow back up with Heart, Body, and Soul, doing something live and in person with Dr. Hinson and Dr. Jones, so everyone can get to meet them. But before we go, as we wrap up, I know there are a few questions that came in. One was, can exercise help heart health? We know that it absolutely can. And here, another question is sort of, what is the point of taking medication that has side effects? Well, I will say you need to pay attention to, as a patient, I will say, if you're taking medication that has adverse side effects, you should be telling your doctor, communicate with your doctor immediately, letting them know what the side effects are and how it's impacting you, so that the doctor can work to adjust or find another medication that can work better for you. Would you say that's correct, Dr. Hinson and Dr. Jones?
Yeah, there's no drug that has a benefit that's without risk. Everything that we do is risky, all right, or has a risk, I should say. So every medication that's out there has a certain side effect profile. And so, as you mentioned, it's really about, one, if you are having side effects, what are they? How severe? Are they tolerable? Do the benefits outweigh the risks of the side effects? And then, you have to be cautious of a lot of, well, or at least your provider has to be cautious of the drug interactions, because there's a lot of medications that are metabolized by the same machinery and the same proteins, and so they alter how strong each drug is. And so that becomes critically important in terms of how we put certain medication regimens together. Again, as a holistic provider, as someone who's more of a naturopath than I am anything else, I would like to see people come off their medication and onto more natural therapies. But even that carries substantial risk. All right. Not all herbs can be put together. And if you have medications that are critical, a lot of herbs interact with those medications. And so you have to be very mindful about what you're mixing, and then to keep your provider posted about the things that you're doing that they may not necessarily have prescribed. A lot of people are doing herbal supplements and nutraceuticals and all these things that when you go to your doctor and they say, well, are you taking anything? Include those also, because we're going to want to ask our pharmacists, are there any drug interactions? And then if so, what is it? Will it cause me to have to increase the medication or decrease the medication? Do I have to look at certain organ systems as potentially being harmed from them? And so it becomes critically important to maintain that level of transparency and honesty with your provider.
Yeah. We're going to close. So I want to, as we wrap up, I want to ask you both, what are you maybe 2 or 3 simple changes or steps Black men can make today to improve their heart health? And I as we say Black men, I think it really reaches everyone, but we're focused on Black men. So I'd love for you to answer that.
3 things.
Mm-hmm.
I would say first, to educate yourself, right? As I mentioned earlier that the difference between illness and wellness is a matter of information, right? And so we have to get back into being active seekers of the truth and not just passive receivers of information, right? A lot of times we're getting our news, we're getting what we consider to be valid information from our favorite content creators, but they're not always credible sources. You have to be very cautious about what information you're receiving. I see all the time, it could be somebody like Shorty's fresh off her BBL, and now all of a sudden she's a nutrition and fitness expert. Like that. That's not somebody that I consider necessarily credible. You have guys out here who read one book and now all of a sudden they're an expert critique on that topic. Like, no, we have to get back into doing our homework and being proactive about our health and the things that pertain to us, whether you're sick or not. You should be reading up on, how to prevent things from occurring. All right. The second thing is, I think, from a practical standpoint, I think we need to get back into the habit of fasting. Now, granted, fasting is not for everyone and not safe for everyone. But I think in general, just given how much we eat and how frequently we eat, that's largely the reason for why we're developing so much insulin resistance and obesity and heart disease and hypertension and diabetes. You know, we didn't eat this way throughout our evolution, you know, and I think we have to get back to how we were originally, get back to our original diet. This diet, this American diet, this Western diet is not for Black people. It's not for people of African descent. It's not. You know, we don't come from areas, in particular, if you're from like the western part of Africa, we weren't consuming meat at the same level that we consume meat here, and dairy and all those things. Like these, we know that dairy is increases our risk for breast cancer and prostate cancer. So, you know, why consume something that you know increases your risk for cancer? Meat consumption itself, especially meat that's grown and produced in the U.S., is highly carcinogenic, meaning it causes cancer. All right. And it does so because these are highly inflammatory foods, you know, these highly processed, nutritionally deficient foods. It's no good for us. We have to get back to eating clean, get back to eating alkaline, like what Dr. Sebi used to say, which are foods that grow from the earth, our plants, our fruits, our veggies. And so, you know, so I would say those are the three things: educate yourself, learn about the importance and safe fasting habits. I'm a big fan of the 16-8 and 18-6 time restricted eating, the intermittent fast, and then consuming a more natural alkaline diet. I would say those are my top three things.
Thank you, Dr. Hinson. Dr. Jones.
No, those are great. That's great. It's tough to follow. I would say, you know, paying respect and homage and cultivating relationships. I think that's the common theme that I would leave with the viewers, and relationships from in, as I said, the world within, the relationships that you have with all those organisms that support, you know, our day-to-day functions, eating foods that support the microbiome, of positive of healthier bacteria, so fermented foods, you know, as Dr. Hinson mentioned, fasting, which helps the turnover of dysfunctional mitochondria, right? And so relationships are key to everything that I think about. And so with that relationship within, you know, in terms of eating, and then exercise, your relationship with your body, right? And making sure that, you know, you're getting in the, you know, high intensity quality exercise that really promotes the growth and support of your body, your mitochondria, your muscles, right? And as you get older, what happens? You lose it. You have the concept of what's called sarcopenia, loss of muscle mass, but that can be blunted with exercise, strength training, which is profoundly important for your health. And so we know that the muscle density has a direct relationship to your risk of cardiovascular death. And then thirdly, so relationship with your inner, you know, the bacteria, your body, and then, you know, relationships with your family, right? Because those are the people that are going to support you in doing the right things, right? We know that people that are in loving relationships, guess what? They actually go to the doctor and more than those that are not in loving relationships, not in relationships at all. You know, the social isolation, the plague of what's happening right now is a direct impact on not just your mental health, but also your vascular health. And so cultivating and maintaining and supporting those relationships outside with your loved ones, your friends, is tremendously important to avoid the mental the mental stress that we face on a day-to-day basis, burnout, right? And so it's critical that we support the various forms of relationships that exist in our life.
Man, Dr. Hinson, Dr. Jones, I can't thank you both enough. I mean, it's like about to be 8 o'clock. There's so much more I know that you both have in terms of information, knowledge that you can share with the public and our viewers here. But what we will do is we will come back to this. We are going to do something, like I said, in person, so people can come out and get to meet you both. But I want to thank both of you for your time today. And just before we go, where can people find you and connect with you, especially if they have any questions after this? Dr. Hinson?
Yeah, so you can follow us on Instagram at MediRootz_medicine. That's MEDIROOTZ_medicine. Or www.MediRootz.com. So again, MEDIROOTZ.com.
Excellent. Dr. Jones?
All right, so you can follow my IG, Brooklyn Cardio, BKLYN CARDIO. We have an IG page and Facebook page, and also my website, www.BKLYNCARDIO.com, BrooklynCardio.com.
Excellent. So that's MediRootz.com, MEDIROOTZ.com, and BrooklynCardio.com. That's BKLYNCARDIO.com. Gentlemen, thank you both. I really, really, really am grateful to have had you here with me today. Enjoy the rest of Jamaica, the rest of your stay in Jamaica, Doc. When you come back, we're gonna hit you with some cold weather when you get back.
Right, yeah.
we got a freezer for you when you get back.
Oh man,
I think Dr. Hinson and I will pay you a visit with some ice, a bucket of
yeah.
ice.
That's right.
Not looking forward to it. Yeah.
but thank you both, and I will see you both soon, and we'll keep spreading the word, and of course let people know when we'll do this again next. All right, thanks so much for your time. All right, thank you. Yeah,
Later.
man. All right, cool.